Right. Thanks, Norman. Hey, everyone, and welcome to the Vibes.
Uh, Unmute.
All right. Thanks, Norman. Hi, everyone, and welcome to the Vibes' 2021 budget panel, powering through a pandemic. The tabling of the federal budget, only 2 days away, comes hot on the heels of unique circumstances. A pandemic-induced economic crisis has destroyed income streams of businesses and households. Bank Negara Malaysia, in a statement yesterday, following its decision to maintain the overnight policy rate at 1.7%, has pointed out that the pace of recovery will be uneven across sectors, with economic activity in some industries remaining below pre-pandemic levels. Now, politicians too have taken advantage of COVID-19 only to be rebuffed by the Yang di-Pertuan Agong. And in the wake of that, we have the prospects of a so-called unity budget that will require Prime Minister Muhyiddin Yassin to strike a bipartisan deal. Now, to be sure, the government of the day has executed a series of relief measures to mitigate COVID-19, including tabling temporary measures bills in Parliament to fund programs under the Prihatin and Penjana schemes. But there's always sentiment that more could and should be done. So joining us today are Tricia Yeoh, Chief Executive at the Institute for Democracy and Economic Affairs, Farhana Roslan, Visiting Researcher at the Research for Social Advancement, and Nazihah Noor, Associate Researcher at the Khazanah Research Institute. Now, before we begin, some housekeeping. As this is a live forum, you are more than welcome to ask our panelists questions at any time. In fact, you are encouraged to do so. If you're watching us via Zoom, use the Q&A button below. If you're following us on Facebook, you can relay your questions in the comments section below the video. Now, given that we have an hour, only an hour, we'll do our best to answer all your questions, but do keep them strictly budget related. Now, let's get started. So the finance minister has signaled that next year's budget is going to be bigger, meaning expansionary. But the government has already implemented 4 relief packages with a fiscal injection totaling 55 billion ringgit. Now, Farhana, I'd like to start with you. And what's your assessment of Malaysia's fiscal position going into budget 2021? Are we going into this from a position of strength or weakness?
Hi, everyone. Thank you very much. Assalamualaikum. And thank you to the Vibes for inviting me today. Let's get started right away. And I think it's pretty interesting. We're starting the discussion today on whether on the fiscal position, right? Because all the discussion that we've been hearing about the budget is about how it should be centered around the well-being of people. And so, but personally speaking, I think admittedly, this is an important way to start the discussion, because let's get the discussion about how to fund this budget out of the way first at the very start. And so as you said, 55 billion fiscal injection, meaning this is cash directly pumped into the economy in terms of Bantuan Prihatin or wage subsidies. That alone, I think the finance minister has said, in news forums that it's going to about 20% of the budget of the GDP of Malaysia. This is how much Malaysia has put in since the COVID. My own calculation says it about 4% if I take into account Bank Negara's lower end range of minus 3.5%. But I think this is where the whether it includes the moratorium and all these other EPF withdrawals and all that. So the point is, it's a lot. It's a major percentage of the GDP. What this also means is that if we borrow this entire 55 billion this year, right, that could mean that our fiscal deficit is going up by exactly that amount in percentage points. So what we've been looking at is between 3.3 to 3.5% deficit. This will go up to even 5.8 to 6%, which is actually quoted by the finance minister himself. So we want to talk about whether we're entering this in a position of strength or weakness, right? We can think of it in 2 ways. Firstly is whether we have the ability to borrow. Are we at a okay place to borrow more? And secondly, if we're able to generate more revenues, right? And revenue generally means tax, income, or petroleum in our case. On borrowing, we all know that there's been a bipartisan support with for the ability for the government to raise government debt to GDP ratio to 60% from 55% in August. I think Parliament has passed that. It means that the finance minister has said that most likely it will raise our in actuality our debt to GDP ratio from about 53% pre-crisis to about 56%. So there's still some space up to 60%. And I think that there's at least two reasons, and this have been pointed out by the REFSA budget brief. If you want to see our sort of wish list, it's available on our website, refsa.org. There's at least two reasons why we think that the government should borrow and is able to borrow. Well, firstly, the whole world is borrowing now, right? It is not the time when traditional implications of the large budget deficit, like sovereign ratings, higher cost of funding and all those things are not necessarily going to apply this year. It's still there, but it's in relative terms, everyone is borrowing. Number two, borrowing costs have also significantly reduced. As you mentioned earlier, yesterday, the BNM has maintained the OPR rate at 1.75%. Now, it's worth noting that that is the first time that it has been that low since the interest rate framework has been introduced by Bank Negara in 2004. So, it is, I believe that the rate of decrease was faster during the GFC 2008-2010 financial crisis for Malaysia, but it's never been this low. So again, let's in that sense, it's an okay time to borrow, right? So, but these are sort of strengths that are coming from the external, right? So it's not about what we do as the country. So I would add a third reason, which is that one of the major strengths of the Malaysian fiscal position is that we have very low foreign borrowings. So even though we're like highly indebted, the government is borrowing a lot, about only 3%, and I don't have the latest data, but about 3 to 5%, definitely less than 5% of the borrowing is actually in foreignly denominated currency. So we're actually borrowing from our pension fund, from EPF, from local money, right? So in a foreign exchange perspective, that's kind of a position of strength, I would say. But the second part, which is the harder part, which is our ability to generate revenue, right? And of course, this is difficult at this time. I think in June, Q2 numbers are seeing almost all of the components of GDP, except for government spending. So fixed capital formation, private spending, which is about 60% of the economy, net exports are all down, right? But we've seen some recovery in net exports. We have a generally diversified economic structure. So, despite the fact that we cannot, raise as many revenue, we are relatively, so in a relative sense, we are coming in position of strength. So that's, if I would err on the side of saying that we are coming to this budget in a relatively strong position.
All right, great. Now, Nazihah, as public healthcare will continue to be an important topic leading to the budget tabling. What's your take on this? I mean, does the government have enough firepower to table a budget that includes a comprehensive allocation, especially for health? So, based on your estimates, how much are you expecting the government to set aside this year for health alone?
Health will be a big for the budget for 2021, and rightly so. And as Farhana has mentioned, actually we do have some space, some fiscal space to be spending on enough on public health and also on other social protection programs. Because we also have to think about whether or not we can afford to not spend on public health right now and for the upcoming year. Because if we don't spend now or the upcoming year, the cost will be even greater in a few years' time. And the good news is that the government has given indications that it is committed to putting a special focus on healthcare spending for budget 2021, despite the economic contraction that we're seeing, as the Minister Tokpa has announced a couple of days ago. But I would also add that it's not just a matter of spending more, but it also matters what we spend on. So in 2018, for example, the actual government expenditure on health was about 31 billion ringgit, but only about 2.4% of that was spent on public health services, which includes preventive services like vaccination programs, disease outbreak monitoring, health screening programs, and so on. And so in 2018, most of the government's health spending was actually on medical treatment. We spent about 71% of the government spending on curative care. And of course, curative care, medical care is a hugely important part of a country's health system, but we also can't afford to neglect the prevention services, especially now that we're in the middle of a pandemic, where we need to make sure that our pandemic tracking and response teams are sufficiently enough funded that they can do what they need to do to get ahead of this virus, to do things like contact tracing, stockpiling, protective equipment, and so on. But at the same time, I would remind everyone that there are a lot of other ministries and agencies other than MOH whose work and policies also have a big impact on public health. The Ministry of Transport, for example, could play a big role in ensuring that there are enough train carriages, for example, so people don't have to crowd together closely when taking public transport. The Ministry of Education also needs to be well funded so then they can continue to deliver education. Right now, otherwise we risk seeing millions of children in the country having their education disrupted at the expense of their future. So policies like this are also really important because ultimately health isn't just shaped by the health ministry. So what this means is that for the budget, instead of, it's not just a matter of giving MOH a bigger share of the budget pie, we must also make the overall pie bigger so that the important work of other ministries aren't compromised.
Interesting. I mean, yeah, but there's always this question, right? I mean, can we flatten the COVID-19 curve without flatlining the economy, though? I mean, what's your take on this, Nazihah?
Yeah, so absolutely, we are, sometimes we see this debate of public health versus economics, lives versus livelihoods. But what I will then remind ourselves is that actually we have seen places around the world that have successfully, contained the spread of COVID in their countries without, seeing too much damage done to their economy in economies like Taiwan and South Korea, for example. And the thing is, I think what's really, really important for us to remember is that we can't have a thriving economy if we don't also do what we need to do to protect health. So say if businesses are open, but people don't feel that it's safe enough for them to go out and shop, then the businesses will still suffer. And, or if businesses are open, but then when people go to their workplaces, they get sick. And, we've seen in the last few months, especially that there are, a lot of clusters emerging from workplaces, then that's not really going to be conducive for the economy either. But on the flip side as well, but if people are worried about losing their jobs, but, paying their bills, but their ability to put food on the table, then they might not really be able to care so much about protecting themselves from the virus, much less worry about protecting other people from the virus. So we really can't have just, a public health protection or just economic protection. We really need to have both, and they aren't opposing objectives despite some of the debate that we were seeing.
Right. Farhana, what's your take on this debate?
So I think the question was, can we actually protect the economy and protect health without flatlining the economy?
Yeah.
And I guess I totally agree with Nazihah. They're not necessarily competing objectives, but theoretically speaking, it really depends on the structure of the economy. We tend to produce stuff that needs people to be outside because they're retail trade, motorcycle repair, wholesale retail. These are the kind of things that are driving our economy, and also exports, things like LNG, LNG, palm oil, things that people outside of Malaysia need to buy. And so if this is the kind of structure of the economy that we have, it's going to be very hard to grow GDP or produce or grow the economy without, when you put people out of the streets, right? And so if we were to come into this pandemic with, with a much more digitalized economy, like you mentioned, Taiwan and South Korea, there's a lot of things that are being produced by the economy that are not dependent on whether people are in the streets or not. And the same, I mean, we do have, little, areas of hope, right? E-services are burgeoning, network services, telcos are doing really well in this time. So if we were targeting our economy where more of these ICT sort of digitalized and professional services, even I would say things like, lawyer services or architectural services, these are all like higher value services. These need not be about people going out on the streets and spending. We can spend while being at home. And this is why we cannot stress enough the importance of putting money in people's pockets, especially in the bottom 40%, or people at the bottom of the food chain, because these people have the higher marginal propensity to consume. So a high percentage of whatever they get, they will consume more than rich people. A small percentage of the extra dollar that they get, they will spend. Most of it will go into savings. So we need the people who will spend most to spend, which is why it's very important for these people to actually get the cash into their pockets, and so it's being spent.
Right. Yeah, I mean, speaking of, cash, I mean, it's actually, I mean, this point here, I mean, comes at a time when, Malaysians themselves, or at least some Malaysians, are already urging the government to sort of allow them to withdraw from their EPF account 1, right? And this is, I mean, this is their retirement fund. And of course, some would say that's not an ideal situation, because, but then again, if, there will be no retirement fund if the present needs are unmet. So, Farhana, since you were talking about this point here, I'd just like to expand on this a little and ask you, I mean, aside from the politics governing cash handouts and transfer payments, what challenges do you foresee, in making, a broader cash transfer program, to sort of implement that kind of policy here, given, I mean, under this environment? What's your take on that?
Sorry, just to clarify the question, it's how can we give more?
How can we scale this up to reach a wider population in this time of crisis? And what are some of the challenges do you foresee?
Well, let's start the challenges, right? Because the challenge is affordability, is whether we can do this, and we are thinking about we're thinking about expanding revenue base. We're thinking about borrowing. So there's two sources of how you can fund this, right? We can fund this from borrowing, which we spoke about earlier, but we can also do this by expanding tax base. And I can go on for 2 hours talking about how we do not have a fair taxation program in Malaysia, but that's very difficult right now. And no, don't introduce GST right now. But it really is about getting more from people who are actually not paying tax. We do not have enough people within the tax bracket. We're talking about a tax rate of 24% for corporates, right? But in effective tax rate is actually in the mid-teens. So we're worried about going as low as Singapore at 18%, but in reality, people in companies in Malaysia are paying about that much in taxes ineffectively. So from all the exclusions and subsidies and tax benefits and all that, and don't even get me started with people who's not in the LHD and tax. So these are definitely challenges. We can borrow for now, but going forward, when we want to establish a more systematic way of handing out cash transfers to people, it is definitely we need to fund it, right? And Petronas has actually committed 10 billion more than they wanted to at the start of the year, right? That means they've been asked to give more money, and so it is, to me, and this is something that REFSA has pushed for, which is to really strengthen the social safety net within a life cycle approach. And I think Kira has done a lot of work on this as well. You give out cash transfers based on people's, it's universal, but also I hate to use the word universal here because then we'll start talking about UBI, but this is not about UBI. This is about targeting cash transfers, not just to bottom 40%, which is going to be rife with problems of exclusion or leakages, right? So instead of targeting households and just B40 who's earning below X amount of dollars, it doesn't matter how much they have, 10 kids or 2 kids or no kids. It is really important for us to have a social safety net system and cash handout transfer based on the parts of where they are in the life cycle. So for example, kids should get, people with kids, so it will value the number of kids within the family, elderly, people with disabilities, housewives. So if we already have all this in place, like places like Australia and Canada, if you come into COVID with all these already in place, it's a matter of like picking a switch and actually raising up those cash transfers within this already available methods of delivering social security to these people who are actually deserving, instead of going out and find, okay, who's B40 and then kind of going back to the BSH sort of database and trying to give out and not really being sufficient. So this is why I think that the life cycle approach and much better social safety net. So before we talk about giving out more and more cash handout and worry about it being like making people lazy and not work, we should really think about who within the life cycle is going to deserve the social safety net and really provide it for them. And I think that is something that Malaysia really needs to do.
Nice. Tricia, I'd just like to get your thoughts here. I mean, how do we ensure such social programs are well governed, that some of these programs really reach whoever they want to reach, and it's not subject to abuse, or, wastage and leakage and so on?
Hi, Emmanuel. So thanks for inviting me. Thanks to Vibes for this panel discussion. It's a very important one. Before I answer your question, I think I just want to say how important this particular budget is. It is the first Perikatan national budget. And, it's for many number of reasons provides a significant document for the country. I mean, firstly, like I said, it's the first PN government budget that will indicate what their own economic position is, because I think that has not been very clear. There was supposed to have been the 12 Malaysia plan, as well as the more fleshed out version, the policy document version of the shared prosperity vision. But neither of these two documents have come out. So in actual fact, I think the only indication of the economic direction of the PN government that you can see is from the stimulus packages. And stimulus packages were to address a very short-term measure approach of just the COVID public health crisis. So we haven't actually seen, like what is the long-term economic positioning that this government will take. So that's one. The second thing is, providing a direction for the country and for the industry as well. Yes, there are other long-term documents, but this will be important for industry. So to know, okay, what is the direction, the tone that you're going to take? What's the approach that the industry will be able to get from this? And finally, of course, the largest public expenditure document for 2021 in light of the pandemic and the economic fallout resulting from that. So going back to your question, I think was basically how can we expect the budget 2021 to be people-centric, right?
Correct.
Yeah. Of course, every government will tell you that the budget is going to be people-centered. I mean, I can assure you that the theme, without even knowing anything about the document from the MOF, is going to be, it's people-centered budget, right? It'll be talking about the rakyat, and that's going to be like the thing that you hear over and over again. But in order to do that, I think we have to balance between the benefits that are going to be derived from the budget in the immediate term and what will be for the long term. So there will be some things that need to be rolled out in an immediate basis. So you will see things like cash handouts. I mean, I expect that there'll be different kinds of versions of these cash handouts, whether it's directly into the pockets of people through another version of the BRIM. But I think we also, while thinking about the immediate term, people who are out of jobs, especially the vulnerable communities like women, like youth, the what do you call that? The wage earners, those who earn wages on a daily basis or on a monthly basis. So I think you will see that. But I think what's more important, and I'm glad that the beginning of this discussion where Farhana talked about the fiscal strain that we're under, or rather putting out the right questions about where the sources of the revenue is going to come from, because most people will not really be able to think about what the long-term impact would be, and so there is going to be a lot of pressure on any government. So whether or not it's Perikatan Nasional, I'm sure that if PH were in government today, they would be under the same strain of having to come up with immediate cash transfers, which you need to borrow to fund. You need to either borrow, increase your all the things that Farhana mentioned earlier, increase your debt to GDP ratio, increase your fiscal deficit. So you're spending now, but you also need to think about the long-term implications of that, because when you spend more now and borrow more now and increase the debt now, that also says something about the future, the long-term future. So what are you hedging against? You're borrowing against the future of, like, say, in 20, 30, 40 years from now. If our economy is not able to recover as quickly, then you're seeing a situation where these ratios will grow and grow. And what does that say, number one, about the stability of the economy? And yes, I think, we've talked about the ratings and how that will affect the country ratings. Some people are a little bit skeptical about the way ratings work anyway. They believe that, you know, we should not entirely depend on these ratings, but let's also face the fact that they do impact upon investors' confidence and how they view upon the country's economy. But more importantly, how will this also affect the future generations of Malaysia, right? So the more you borrow, the more debt that you will lay upon the future generation, and you're actually betting against the ability of the economy to recover quickly in order to kind of buy back that time, buy back the amount of money that you had borrowed in the past. Petronas is actually a good example, right? So Petronas, it's actually not a renewable source. We know that it's oil and gas. We have been very fortunate in Malaysia to have had our economy fueled by the revenues from oil and gas. And, you know, but if you look at the actual proportions of its contribution to the revenue base, that has fallen over the years. It used to contribute about 30%. Now it contributes about 19%. And of course, we also know that it's an unpredictable market because oil, the US dollars per barrel, that fluctuates, and it's an uncertain economy. So that is one of the good examples of how, you know, if you're going to take the revenues from Petronas, and yes, we have increased dividends under the PH government before, contributions from Petronas. I mean, we are not, you know, sustainably able to depend on Petronas as a cash cow for certain, in consecutive 10, 20 years. And after that, we still need to think about the growing tax base. But I know that that's a difficult topic to talk about today because we are looking at this economic fallout from the pandemic. And I would say that in principle, we can spend, but we do need to balance that discussion with the consequences of the future.
Right. Okay, now I guess some questions are already trickling in. So I'll just field this question to Nazihah, right? And this is from Parameswari Paramaselvam. Good afternoon. Should the allocation for vaccines be reviewed through a population questionnaire to assess public demands prior to acquisition? What do you think about this, Nazihah?
Yeah, that's a good question. There are so many uncertainties about the vaccines right now. There's a lot of pressure on the developers and manufacturers to like really speed up the development and production of vaccines. I think as always with every single vaccine, the primary concern has to be safety. It's not just a matter of whether or not the vaccine actually gives you protection against the virus, but it's also, you have to consider what are the potential side effects. And sometimes the thing that we really need to consider are actually the long-term side effects of vaccines, which, we can't really see if we don't give it enough time to develop for us to do proper trials. So I would hope that will be the main consideration. Safety will be the main consideration when it comes to, acquisition of vaccines. But of course, then another question is about whether or not the vaccine, even if we find a vaccine that is safe, that is efficacious, whether or not it is actually then accepted by people.
Right. Okay, thanks for that.
I feel that it's acceptable, right. Then they won't really be able to take it.
Okay. Right. Thanks again. Thanks for that, Nazihah. Now this is for Tricia and Farhana. Okay, this is about the loan moratorium, and the question is just pretty much straightforward. What is your view on the call to extend the moratorium? And what is the impact on banks if the government were to extend such calls?
Okay, so I'll take that first. I think that, of course, that would be a demand that is unsurprising because the loan obviously takes up a fair chunk of your spending per month. But having said that, I think that the approach that Bank Negara has taken now, which is a targeted extension, so people actually can apply for the loan moratorium as opposed to it being a blanket rule. I do believe that that would be a reasonable approach to take. I don't think that the system as we have it today will be able to sustain a long-term moratorium. And because if you extend it this time, then there will be pressure again to extend it again the following 6 months, the following 6 months. I mean, people actually, we don't know for certain how long the pandemic is going to last. As Nazihah talked about the vaccine, it may not even be able to be marketable on time. And, is it commercialized at the right rate? Can governments afford it? So there's a lot of questions around the vaccine. So until that happens, I believe COVID will last for a longer time than we expect. And so again, moratorium cannot be extended for blanket for everyone. And I mean, one of the realistic reasons for not extending it in a blanket way is simply that, it's going to be very difficult at the end of whatever that moratorium period is, to determine whether or not that individual or that group of individuals will eventually have non-performing loans, right? And if anyone has already had the benefit of, say, all of us did receive some cash transfer into our banks, but did that affect our spending? And the false assumption that you have additional funds in your bank means that you'll be spending probably a little bit more than what you need to. But the point is, I think targeted loan moratorium extensions would be all right, because then this also helps to identify the specific households, individuals who are most in need and who are most likely to fall into poverty and hardship. And that definitely should be the focus of all of the different social welfare programs. So not just the moratorium, but we need to be able to identify, and this is where data is important and data sharing is important across the board, right? So federal government welfare agencies that have access to data of poverty need to be sharing this across ministries, across state governments, and across agencies. There's a lack of information, lack of data. People don't know where the families are and whether they're actually receiving like double, triple amounts of social support. So data sharing is important, targeting is good, and of course, making sure that those families that really need it should not fall into poverty and hardship.
Right. And what about you, Farhana?
Yeah, of course, I generally agree with Tricia. In fact, I'd hope that the loan moratorium was actually done, the targeted loan moratorium should be done from the start rather than providing this blanket. It should never be blanket because some people in reality are still having jobs and salaries coming in into the bank accounts every month. And so the sheer, and this is where I pay some respect to the market workings, and which is that the sheer effect on the banking system that for people when people are not paying, banks are essentially not receiving any revenues, right? And so for that sheer effect on the banking system and the long-term repercussion on things like, for example, the banking system is invested in from the biggest funds, right? Our EPFs and tabung hajis and whatnot, and also foreign investments, right? So if market and investor confidence is just so tarnished by just this ability for the government to say, hey, well, stop collecting your own revenue, then this is a huge it's a huge thing, right? But also at the same time, of course, since this is a COVID time, targeted when people really could apply self-select and ask for loan moratoriums and to the people who really deserve it, and then that's I think is the fair middle way for this.
Right. Nazihah, Tricia earlier mentioned about data sharing, right? Across the board. How would this really affect or impact health policy in your opinion?
Yeah, so as a researcher, our bread and butter is data. So I will always advocate for better data sharing. And yeah, because, okay, so in places like the US, for example, when it comes to COVID, because of the extensive amount of data that they collect and then share with people outside of the government, a lot of academics have been able to see that the pandemic tends to disproportionately affect people who are minorities and also people who are lower income. But these are not some of the things that we have been able to assess in Malaysia, at least not from outside of government. But if we were able to get some of these data, for example, we can then also advise, like perhaps there are certain groups that we are neglecting, and like in places in Sabah, for example, we need to understand better why are their fatality rates is so much higher than the rest of Malaysia, and is it a function of the income of the people who are the worst affected, or is it a function of the access that they have to healthcare services and so on? So yeah, definitely we need a lot more information on the health profiles of the people who are affected, so that we can inform public policy decision making.
Right. Okay, we have a question by Munira on Facebook, and her question is about unemployment and underemployment. So how long is it before we can see government policies and especially the Prihatin packages to actually bring positive impact? What are your thoughts on this, Farhana?
So that question requires some forecasting. It's something that I unfortunately don't do and haven't done as much as I would like to. I think, well, there's two things, right? So number one, it's survival. So if we're talking about employment, underemployment, then I think the Prihatin packages are really just about surviving and getting through this storm. We don't know for how long, but I would advocate for, as long as it goes, you need to put money in the pockets of people who need it most. Now, whether or not that creates new opportunities for jobs, right? Things like delivery, things like food delivery or package delivery, or even more data analysts within the likes of Lazada or Grab or things like that. Then it's then a question of this gig economy and protection and the stability of these kind of jobs. So underemployment is when you don't employ enough of your youth, and I think the boom of this digital e-payments, e-delivery, e-food, e-everything is providing some kind of employment for especially our youth, but whether or not that is going to translate into longer term social security and things like that is another issue. So I think when we talk about employment and underemployment, we need to think about whether it is going to be the stable, the formal sector, or even a informal sector, but sufficiently provided for kind of employment. And I think that is the real question. One of the things that we are advocating for is actually the other half of the labor, not even the labor force, the working population, the other half of the working population that are not currently signed up to the EIS, the employer insurance scheme with SOCSO, should be signed up. And I know it's too late. It's too late now because we're already in crisis terms. But if you were to at least, the requirement is you have to contribute for 12 months, before you qualify to claim for SOCSO EIS. But at least there's some program where if you don't meet enough of that, then you could still get some kind of token from the EIS pool, pension, the EIS insurance pool, right? So ultimately, it is a pool, it is insurance. Some people who are not under job stress are actually also still contributing to that pool. And so there is some money there. And I think that pool should be, an insurance. And since I think we should onboard these other half of the working population who's not yet on the EIS to at least get some, some cash from there. And that I know requires some laws to be passed, because I know EIS now doesn't cover the government civil service. It doesn't cover migrant population within the workforce, and it doesn't cover housewives and people in the informal sector. So at least if we could onboard some of the people in the informal sector, then we could at least start talking about social protection for people who are actually employed during this crisis.
Right. Tricia, this is from Sadan Muhammad Nadir. He's asking, can we implement UBI, Universal Basic Income, and what are the specific? That's the question on UBI.
Okay. All right, thank you, Muhammad, for the question. So the UBI, I mean, it's quite a sexy proposal, and it's not necessarily new. So UBI is a universal basic income in which the government provides a basic income across the board. And the argument for it is essentially that people, when they receive that UBI, they are able to then use the excess time that they have to contributing greater value to the economy, right? So without having to take on jobs that may not be paying as well, but yet, not able to contribute like value. But there are also arguments against that. Of course, the most common and popular argument against the UBI is essentially that if you're giving people money to not work, then what's the incentive to actually work and provide that value, that kind of value back to the economy? It's a very tough thing to manage. I think that there have been experiments in some countries to implement a UBI, but it's not been very well. I think it was only was it Kuwait, one of the Saudi Arabian, some in the Middle East countries has implemented UBI, but it's not been rolled out in an extensive way across the world. But having said that, I think what the Malaysian government has done through its BRIM and some sort of cash transfer system, it does not replicate the UBI entirely, but it does provide a sort of similar. I think the idea is somewhat there, that you provide some form of protection, and then over and beyond that, those who are within a certain group would then go out to create value in the economy. But in Malaysia, it's been rolled out only in a targeted way. So I think in the sum of things, I would still go with the approach of targeting as opposed to a universal, basic income, but that already means that it's not universal, right? So I guess my short answer to your question is that I prefer a targeted approach rather than UBI. But I just wanted to go back to something that was being discussed earlier about the informal sector. So I completely agree that, much more needs to be thought about in a long-term basis about the informal sector, because this sector, does not receive the same kind of social security and social protection that many others that are employed in the formal sector receive. So the government needs to have, and we've spoken to some agencies in the government, right? So they don't necessarily have that data as well, because it takes a lot of effort and it takes a lot of money to speak to your makciks and your pakciks who are actually selling in the stalls or in the pasars across the country, who they are, what their needs are, and then compiling it into that database. So a lot more needs to be done for the informal sector. And then just kind of riding on that digitalization as well. So Ideas has been doing quite a bit in recent times on looking at, how digitalization can help say in the retail sector. So we're releasing a paper tomorrow on the retail sector in the time of COVID and how digitization can help them. So there's a lot of buzz around digitization, but there's a lot that we still need to unpack about it. So yes, on the one hand, it can create jobs and enable the economy to prosper and provide more employment. But then, the Grab drivers, the workers, what is their protection? So I don't think that they actually have the same kind of protection as well. So yes, digitization, but can digitization, truly contribute to the value chain? And we've talked such a long time about escaping the middle income trap. Yes, digitization, but I think it has to be digitization plus, right? Really looking at the way digitization itself can be transformed as a sector of its own.
Mm-hmm. Nazihah, we are looking at, since we're talking about digitization, how would that sort of, work with health policy, especially with all the demands that we are facing right now?
Yeah, so actually we're probably quite a bit behind in terms of, integrating more digitalization in our health policies. And a really important place for us to start is actually to start having mandatory nationwide electronic health records. Because what happens if we don't have electronic health records, what happens is we will continue to have this sort of a fragmented healthcare system where, if a patient goes to see their GP for primary care, and then they then go to a hospital, then those two healthcare providers actually don't communicate with each other. And this can introduce a lot of inefficiencies, which then introduce a lot of, extra costs and whatnot. Whereas if we have, reliable electronic health records system, then we can have a more integrated health system where we only get the hospitals, the tertiary care providers to really focus on things that they're specialized in, and then when it comes to managing diseases like diabetes, which are chronic, then it's not really it doesn't really have to fall on the responsibility of the tertiary care providers like hospitals and whatnot to manage, because then they can share a lot of the results of the tests that they do in hospitals. They can share that directly with the primary care physician of patients. So that can eliminate a lot of the redundancies that sometimes have to happen. So I think it's something that digitalization is really something that we need to integrate more in our health policy. But of course, it's not going to be just that easy. There are a lot of other concerns as well, especially when it comes to health data, that are concerns about privacy, all kinds of concerns about the safety of our data and consent, and whether or not Malaysians are ready to consent to these things. And of course, beyond just privacy issues, we also have to think about whether we have sufficient infrastructure across all of Malaysia, like especially in more rural areas, for greater digitalization in healthcare.
Okay, thanks for that. This is from Agash Bose. He's asking, basically PH is calling for the Malaysians at Work program to be re-implemented. So is this program a feasible method to create sustainable jobs for Malaysians, considering the effects the pandemic has had on businesses? And wouldn't this program also pose a possibility towards inefficient use of labor in businesses? Who wants to take that up? Farhana? Tricia?
I could start, but maybe Tricia will add more perspective on the PH front. So Malaysia at Work, we need to rethink. Basically, Malaysia at Work needs to be, at REFSA, we believe that Malaysia at Work should be reinitiated, but there needs to be more targeted in terms of the sectors that we are going to look into. So at REFSA, we are proposing two things. Number one, firstly, the government could create more jobs within the government sector. And two of the most underemployed, I know we talk about how the government is bloated, how there's too many people working with the civil service, but actually ironically, two of the most who needs more staff basically are this health service and the education service. Surprise, right? And what we think that the government can do is actually literally create new jobs within the government sector on the government payroll, and create jobs such as teaching assistants, lab assistants, and medical assistants, hygienists, and a lot of these jobs that can take up a significant portion of the available labor force which are not currently employed. Number two is actually to target specific sectors, and this needs a lot more time to be talked about. But this concept of building back better, which is something that a lot of people have been talking about. The UN system, the World Bank, and people like them are talking about this building back better, and green definitely has to be at the top of that agenda. And so when we think about creating Malaysia at Work, it has to be we have to use this opportunity to create green jobs, jobs in waste management or agriculture or green technology and things like that. So that is my 2 cents. I don't know if Tricia wants to add.
Yeah, thanks, Emmanuel. So essentially, what was the Malaysia at Work program that PH proposed, right? It announced in last year's budget, and it was supposed to have been rolled out in Q2 this year, but obviously that couldn't happen after the government change. So the program was supposed to be that I think wages and hiring incentives would actually be credited directly into the individual's account. So it was very innovative. I admit that when I heard it, I felt like, okay, this is something new. This is something different that's never been proposed before. Essentially, you are incentivizing people to go and get jobs, right? You're incentivizing employment for people who are currently unemployed. I think it's interesting, but I'm not sure. So I think it's actually a useful tool to do now while country is in crisis. But I again just like the loan moratorium, sometimes I would hesitate to implement policies that have the risk of going on a long term with no end in sight. Because once the recipients, menikmati the benefits of something good, then it's very difficult to take that away. So I would support that on a short-term basis because of crisis mode, limited number of months, and with conditions upon which the incentives will no longer be credited into the account. So, but I think I just want to share a bit of the ideas perspective, right? Yes, we understand this is a time of crisis, and it's important that government plays that strong role in looking out for its unemployed, especially youths or women and those in the vulnerable sector in the country at the moment. But what's more important is to actually make use of the crisis and sort of make sure that the crisis does not go to waste in terms of addressing the existing structural problems that the country had been already facing. So let's face it, right, that our economy was already not looking very healthy even prior to COVID. And what happened during COVID this year is that it just deepened, it accelerated, it exacerbated existing problems, and it kind of like stripped us bare and allowed us to see things clearly for what they are. And so from the ideas perspective, yes, we want to, the ultimate goal is the same. We have the same shared goals of wanting to provide jobs to the maximum number of Malaysians as possible, because we know that it is only through those jobs that they can increase their household income, and they can then provide the better education quality for their children. They have more opportunities, and everyone rises together. But in order to do that, it's not just about short-term incentives, putting money into the account. The entire economic ecosystem needs to be looked at in its entirety, right? In total. So a more competitive economy, part and parcel of the recovery strategy. So we have, of course, recommended that the government consider ratification of the CPTPP, the Comprehensive and Progressive Agreement for Trans-Pacific Partnership. This allows us access to new markets around the world, countries that we don't have already market access to or don't have free trade agreements with. We also need to be able to modernize the regulatory environment, reshape the role of our government-linked companies. I think we haven't actually talked much about the role that GLCs can play in Malaysia in a much more robust manner. And of course, we need to think about sustainability as well. Like, can we promote green technology? I think there will be more jobs in the future within that sector of green technology as well. And of course, strengthen our institutions. So if we strengthen our institutions, ensuring that there's budget transparency, ensuring that the constituency development funds that are given to the members of parliament are decided on a fair and transparent basis. Tell us whether the government is still committed to implementing the initiatives under the National Anti-Corruption Plan, including reforming public procurement, putting a political financing bill in place so that there's transparency in the way that the political money is used to be funded and channeled into parties, and the governance of our state-owned enterprises or GLCs. So I'm just trying to give you like the perspective that yes, jobs are important and we can have quick fix measures, but can we really, address the core structural problems that have already, affected us and plighted our economy, not just this year, but already prior to this. And then you can truly see the transformation of the economy, make sure that it blossoms, it grooms, and flourishes, and investors come in, the economy is more open, and then industry comes and boom, you have your jobs. So that's how you eventually get there. But I think we are far away from there. So until we get there, I understand that there's still a need to have these quick fix measures.
All right, thanks, Tricia. Nazihah, this is a question for you. Is our national healthcare sector on the brink of public health care sector on the brink of collapse?
So I will just say that, despite the recent news that Malaysia doesn't have state-funded healthcare, actually we do. A lot of Malaysians have enjoyed a really, really, highly subsidized public healthcare system for many, many decades now. Then we have to face the question of whether or not this is sustainable in the long run. But then, because we have seen the government saying that they can't keep subsidizing public healthcare at such a high rate. But then I would also ask that yes, while the government is funding the public healthcare system a lot, but actually the next main funder of public healthcare of healthcare in Malaysia is actually private households paying out of pocket. So while MOH spent about 27 billion ringgit in 2018, private households paid 21 billion ringgit in 2018 as well. So if we're going to start thinking of another form of funding our health system other than through government revenue, we also need to start. We also need to make sure that then the burden doesn't fall on households to the extent that they then fall into financial ruin in trying to just pay for the healthcare, especially not during a time when people have lost their jobs, especially not during a time in the middle of a pandemic, where people need to be assured that they can get healthcare without having to worry about payments.
Oh, thanks for that. Here's a question by Wang Puyi. So she's saying that a World Bank expert on poverty once said that the idea that people will not work if you give them money is one that discriminates against the poor, as no one worries about the rich being lazy and unproductive, although they have a lot of passive income. What's your take on this, Farhana?
I think so I think if we're going to have a good discussion, we really need to move away from this poor being lazy and waiting for cash handouts sort of discussion. I think we are too far beyond that. People in the B40 are reported to work 3 jobs. So at least if you give one cash transfer, they could eliminate 1 job and spend more time at home with their kids, right? And they're still going to work with the 2 jobs. So I think the GFC has seen a significant amount of inequality. So inequality is being created so significantly since the global financial crisis, the Great Recession, that I think to even go back to a time where the rich and the poor will be the inequality being narrowed is just too far away, and I think what's lazy is actually rich people's capital. That is lazy. That is not being put into the money, and we're so scared of taxing. We're so scared of putting a wealth tax, inheritance tax, and all sorts of these taxes because this money will run away. Well, there's nowhere to run because everywhere else is all near 0%, right? So I think this is no brainer. Just to level back people to the levels of livelihood, for them to work 2 jobs instead of 3, instead of 4, just to feed their kids. It's just too far. We are just so far from that right now, and so I think we should run away from the discussion of this American style, UBI or cash transfer handout, making that marginal decision whether you're going to add an extra wage hour of wage work or not. I think we really need to think about so this COVID crisis really makes us really need to think about how to in the short term and the long term, think about creating jobs, quality jobs, even if people are not formalized in the informal sector, give a good quality social protection and just all sorts of support for them to continue in this informal business. And globally, ILO a report says that about 44% of people are unemployed or have to find to resort to the informal sector because, frankly, the world is not able to generate enough formal sector jobs anymore. So we need to think about creating jobs, but also creating a good way to support people, all sorts of post-market intervention, sort of like distributional support, cash handouts, transfer, whatever the method is, to support people who are in this informal sector jobs, and these needs to be institutionalized and needs to be done and well thought out much better. And I think this whole thing about lazy, my opinion is that rich people's capital is the one that's being lazy right now.
Oh, okay, cool. Nazihah, this is this question is for you. It's by Muhammad Ridwan Muhammad Kamal. So he's asking that given that the frontline sectors that are handling COVID are feeling the strain and requiring more funding, how much of this will negatively impact the developmental aspects of the budget?
Yeah, so I'll just, to actually build on a point that Farhana made earlier about how, yes, while some parts of the civil service may be bloated, what's actually really understaffed right now is in the health services, and really we're seeing that more than ever with COVID. Even though we've received plenty of warning in the past years that this is the case. So I think one of the things that we need to start moving away from is we can't think of our healthcare workers as just another civil servant, where you can have this policy of one in, one out. But instead, like, we need to have like this idea that we can't give more, we can't give our doctors actual permanent positions. For me, is really, really not right, considering the amount that they have sacrificed for us, for everyone in the past 9 months. And it's not even the situation where we have too many doctors to start right now. We're nowhere near that level when it comes to psychiatrists, for example. The WHO benchmark is about 10 psychiatrists for 100,000 population. We have about 1.3 psychiatrists per 100,000 population. And with COVID especially, before COVID already, about 1 in 3 adults experience a mental health problem. Now with the effects of isolation, the effects of losing their loved ones, etc., we are going to need more and more mental health professionals and generally healthcare professionals overall. So this is something that I think actually for government, we need to shift this thinking of just like, oh, we need to wait for one doctor to retire before we can give another doctor a permanent position. So that's in terms of our development for our healthcare system overall.
Right. Thanks for that, Nazihah. Okay, Tricia, this one is for you. What should the government do about the airlines and tourism industry? I mean, this is from Facebook. It's a question from Facebook. What do you think? What are your opinions on this?
What should the government do?
Yeah, the finance minister has said that the government's not going to bail out airlines. I think he said it twice. So, how should the government go about helping these industries in particular, of the airlines industries and the tourism industry?
Yeah, I mean, this is tough because again, there's a lot of uncertainty around how long the COVID crisis is going to be for. Because if it had already ended, then you could make a decision now, right? Like, okay, these are the amounts of losses that you face. This is how much you're in the red. The government can assist you up to this amount, and then the rest you need to source it for yourself. So yeah, this is tough. I think for airlines, the government needs to, okay, I'll just say broad principles without saying actual airlines, because I don't want to be seen as promoting any particular company.
Understood.
And there are only 2.
Yeah.
But I think the broad principle is that the government should not be seen as bailing out any of these companies, because it's already controversial as it is. Both the airlines, I think, have undergone serious troubles in not just the past, but in the recent past this year. So favoring one over the other will be very difficult. So I think that's all I will say for the airlines. But having said that, I mean, this is a problem that all airlines are facing across the world, right? So IDEAS has not talked about airlines specific to the COVID phase, but we have published a couple of papers about the airline sector in general, where we have promoted a much more open skies policy. So the way aviation works is that sometimes the airlines are not able to be as free as they want to be in terms of looking at access and routes and ticketing options, because countries are closed off. So they made a lot of restrictions as to what kind of airspace is available to other airlines from other countries. So there are different levels of openness and closeness. And so in general, I would say that what can promote the airline industry more generally, so this is not just about Malaysian Airlines, but other airlines around the countries. When I say Malaysian Airlines, I don't mean MAS, I mean Malaysian Airlines companies. So the general principle would be that a much more open skies and an open regulatory approach would benefit all airlines, because then it means that they can have much more flexibility in terms of pricing their own routes. So this is like kind of future, right? When the borders open again. When it comes to tourism, I think it goes back to the same topic that we've talked about earlier, that the tourist companies, the tourism companies, or whether it's like hotels and your Airbnbs and other companies within the tourism sector, they need to really kind of push themselves forward. So what is the future forward for them? Digitalization is one. Getting onto or replicating the success of other super apps, that's another or similar thing from the digitalization process. But the answer is the same as what I said earlier. This is an opportunity, use the pandemic, this crisis as it were, as an opportunity to really upskill themselves, so upskill their own staff, and to invest a little bit into their own business in making sure that when things do recover, they can actually jump on that bandwagon and go much more quickly into the future. I just want to talk about that tax issue that we kind of, I think two questions ago. So that's from Pui, right? Hi, Pui. I think it is a good question. I don't think it. So let's also. I mean, we tend to have that categorization in our head, right? It's like poor versus rich, poor versus rich. I mean, a large majority of the Malaysian population is actually middle class, right? So the middle class, like, where do they sit? I have absolutely no problem in providing that amount of money to the poor, because that already is happening. So that's a cash incentives and cash transfer system. And then taxing the rich. So like, yeah, a broad-based but yet progressive tax base, I think, is the direction to go. And Ideas actually has proposed a capital gains tax, which we currently do not have in Malaysia. So we've published something, I think it was last year or the year before. I think we've got 2 papers on it, and you can look that up. We actually promote like the implementation of the capital gains tax. And of course, the other thing which no one has really talked about here, and I know that it's not going to be acceptable, is whether or not at some point the country would need to reintroduce the GST, which has been abolished.
Right. Yeah, but yeah, speaking of the GST, should the country reintroduce that? I mean, at this point in time?
Well, at this point in time, probably no. I don't think it would simply not be, well, it wouldn't be passed in Parliament anyway. I think the people are definitely strapped at the moment, and that would be not just a political disaster. I mean, because we know it's a political decision, but it would be an economic disaster as well. But I think that for the long term, at some point in the future, probably after COVID, the GST needs to be seriously considered. It's a much more efficient tax collection system, and there are ways to ensure, that it would not affect the pocket, as it were, because if you think about it, like we went back, we regressed into the SST, right? The sales and service tax, and I'm not sure whether people actually really felt the difference. Like, if I were to ask you, Emmanuel, did you feel the difference when the government rolled back GST and then went back to the SST? Like, did you have more money in your pocket? And if the answer is no, then I think there's a way to reintroduce GST such that it does not like affect the pocket so much. So we need to think about the rates and like, I think zero rating certain products for a time being, and then looking at increasing the rates over a number of years.
All right. Thanks for that. Okay, this is a question by Muhammad Hilmi on Facebook. He's asking, is it that the government needs to create more jobs or create a more relevantly skilled workforce? Farhana, what's your take on this?
That's a really good question, actually, and I think that will take another webinar, but on its own. But the short answer to that, I think, is that in the short term, it should create more jobs. It should create more jobs, whether it's in the civil service or whether it's in supporting businesses to create more jobs. And the question of skill is actually a matter of the structure of the economy. What kind of products is Malaysia producing? Are we still producing low-end manufacturing? Are we still producing, is our GDP, is our economy really still made of petty trade, retail, services, palm oil, LNG, which is fluctuating in value, or are we creating economies that are we having sectors, right, that are green, that are high valued, right? And I think I will always go back to this 2018 annual report of Bank Negara, which has this really amazing box that explains clearly how and why Malaysian jobs are still paying very low wages, right? So even as Tricia mentioned, even the middle class, yeah, it's middle relative to Malaysia, but middle class is not earning as much, right? So everyone in general is earning little, even the middle class. They're just middle because they happen to be middle in the distribution of Malaysia, right? And so everyone is not earning as much as we are producing. We're earning about 35 cents to every dollar in dollar terms, 35 cents to every dollar that we produce in GDP terms, compared to about 50 or 60 cents that other comparable economies are earned with the wage. People in wage labor are earning per dollar of the economy GDP produced. So there's something about how the kind of industries that we are creating. So when we have high value industries, then we'll create the necessary skills and jobs, right? There's a lot of mismatch, right? As we know, there's so many people coming out of university with this set of skills and that set of skills, and then the labor market is not able to absorb them because we don't need that many IT programmers to that level because we're still doing petty retail trade, right? So that is the real question. I feel like even if we create super upskilled people, if the job market cannot absorb them, they'll go elsewhere. And then, so I think that is a really good question, but what matters most is that the government drive sectors that are going to be of high value and produce high value economy, and the way to do that is actually what REFSA calls a mission-oriented approach, which means that the government should drive the very early stage investments in high value sectors. And again, that is a whole other discussion of its own.
Right. Thanks for that, Farhana. Tricia, this is from Edison Chung. Any views about empowering export-oriented companies if we want to create a new export ecosystem to map and move in sync with the changing landscape and trade flow? What should we do?
So in terms of exports, okay, so like Malaysia already has like existing free trade agreements, right, with many countries. So as I mentioned earlier briefly, one of the things that we would propose would be for the country to ratify the Cptpp. We've just published like a really long report actually, and we've got another one last year, I think, that talks about the potential benefits. So Malaysia could benefit by ratifying it, and that would increase our GDP by 1%. It sounds small, 1%, but I think as we know that GDP, not just for Malaysia, but around the world has plummeted because of COVID, the country should take whatever low-hanging fruits that it can to boost its GDP without doing very much, right? And at the same time, those would also provide us an additional, 120,000 jobs. So that's actually one easy way for us to, number one, boost GDP, number two, boost jobs, and number three, increase exports as well to the markets that we don't currently have FTAs with. And I think the three that we have not signed FTAs with, which are currently, on the membership of the Cptpp, would be Mexico, Peru, and what was the third? Canada? Or was it Canada, Mexico, Peru? Definitely, yeah, one in the Latin American country. And then going back to, it sounds like a lot of the discussion goes back to jobs. I just wanted to add that I think yes, skills, but actually you think about it. There's this Harvard lecturer that just I just read the article this morning actually about how he says that there's no specific skill that will get you ahead in the future, but it's a way of thinking that will. So actually what you're talking about is promoting a generation of Malaysians that are much more critical minded, who are generalists, who are able to connect the dots, even if you're not particularly skilled in, say, like engineering, or you're not like a cardiac surgeon. So he says that the future actually belongs to generalists, and how you think, being innovative in your mind and being creative, those are the actual skills that we need to try and cultivate. And I agree that that would be what's necessary for the kinds of future jobs. But think about it, so this is where I think I would slightly differ, right, with REFSA, in that I don't think that we can actually predict what are the sectors that are going to be the future of each country, because, you know, a generation ago, everyone wanted to put their kids into, like, say, I don't know, IT, right? Or like programming. And today, all of that is going to be automized. Like the robots are actually going to do the programming. So what career would I want my child to have? I don't think that we are, or government, if in fact, I mean, nobody, right? Humans, we're just not in a position to be able to tell what is the future of the fourth industrial revolution. I mean, it will take us into places that are wild, that are wondrous, that are unpredictable. But the important thing is, like, are we creating creative, innovative people that can grapple, that can adapt, right? That can adapt to whatever changes industry and technology is going to bring us. I mean, if anyone's like watched series and like Black Mirror or whatever, you will not be able to predict what the future is. Like the future, yeah, okay, it sounds very cliche. The future belongs to our children, but our children and grandchildren, they'll be working in jobs that are completely different, that we just cannot expect. The jobs that we have today, that currently we have employed today, are not the kinds of jobs that our grandparents would have ever envisioned to exist. So in that sense, I think it's, you know, just important to create that kind of ecosystem, that kind of culture, cultivate that innovation, the mindset, and then things will flow from there. So it's a lot more general, it's a lot more nuanced, but I think this is something that I think we should take into consideration.
I feel compelled to respond.
Sure. Go ahead.
And no, but that you know, on an educational and preparational children perspective, I have to say I completely agree what you say. But what we are and some of the economists, you know, contemporary economists are also saying is that we're not targeting sectors or picking sectors, winning sectors, right? And I know the public, the market is so sensitive when we start saying the government will start picking winners, right? What we're actually advocating is that the government go for mission oriented, and I didn't want to go into further because of time, but actually what mission oriented means, looking at solving problems, right? So it's not about targeting the green economy for the sake of the green economy, but targeting to reduce greenhouse emissions and the way we do things. And so we're really about the mission, really about the kind of the challenges, these big sector challenges that we're thinking about, and then kind of trying to forecast and kind of having the government taking the first step, you know, instead of waiting for a lagging, you know, business sector to follow. I mean, the internet, for example, and I know if people who've read Mari Matsukato, which we look towards, is, you know, the internet, for example, NASA created, had you know, US government had spent money through NASA and DARPA to create the internet sector, and nobody foresaw what the internet would look like, and somebody had to take that first investment, right? And so this is the kind of things that we are thinking about. Of course, we can never predict, you know, we can never think about what sectors are going to go, are going to be the next frontier or IR 4.0 sort of sectors. And in terms of, you know, educating and preparing our workforce, our children, that's definitely the way to think. But in terms of a government, when you're thinking about, you know, a 10-year plan, RMK, you know, it really has to be, and you're right about it being nuanced, but it really has to be towards gearing towards some direction. And if there's any direction, it should be towards missions and solving the world's greatest challenges today. But things like inequality, greenhouse emissions, and, you know, just the major, you know, instead of mega trends, we're talking about mega problems, right? So I think that's where the structures should I mean, the government structures, the government energy, and any RMK should, you know, look towards.
Right. Tricia, do you want to add anything to that?
No, I like this. I like this back
excellent.
and forth. I mean,
Great.
there's always been that debate, right? Like, okay,
Right.
is it government led or is it industry led? And I do take that there are a lot of innovations in the world today, including the internet, which were government led. I mean, even like everyone talks about the South Korean cars, right? The automotive industry, or even like the South Korean film industry for that matter. So how is it that they are so commercialized today and that they're commerciable and marketable? It's true that the government did actually invest in the initial years. So those were like the real infant industries that the government supported, right? So I do take that, yeah, sometimes the government needs to lead, especially in the high investments, you know, low return sectors. So I think I'll leave it there.
All right. Nazihah, I mean, where does your field, I mean, your subject matter here sort of fits into this discussion? You know, I mean, you cover public health. Yeah.
Sure. Well, okay. I will also say just generally, just, you know, I'm not a labor economist, nor even an economist, but I will just have to add to the points that have been made previously by Tricia and Farhana. We're talking about jobs especially. And earlier, one of the points that Tricia had made is about some of the incentives that we're going to be introducing in the budget. For example, we have to be cognizant that they don't then set up perverse incentives just for short-term gains. But what I will also then add to that is that actually, I believe that we can do both short-term planning and also long-term planning. So something like, for me, budget 2021 is is going to be more for the short-term, resolving the short-term issues. But something like, as Farhana mentioned, RMK is then where we also have to start considering the long-term plans for Malaysia, looking 5 years forwards in terms of, people are saying that right now in the middle of the pandemic where people are losing their jobs, then some people say, oh, thank goodness, we have things like Grab, we have things like Food Panda, et cetera, that then can provide, temporary jobs for people. But I think then also what we need to be cognizant is that we don't start relying on just having these jobs as being good enough for people, because at the end of it, a lot of these jobs, they don't have enough social protection. They're not decent enough. So yes, while they can provide short-term relief, and we should encourage this while we are working towards long-term plans. And this includes things like in public health as well, where we need to have these short-term solutions, but at the same time, we need to work on longer-term issues in the healthcare system, like building more hospitals and healthcare facilities in more remote areas of Sabah. Having all these longer-term plans, like the electronic health records, investing more in preventive services, because these are things that we won't see the effects necessarily immediately, but we will definitely experience the cost of it if we don't invest in it now. So yeah.
Right. Thanks for that. Okay, great. I mean, we've actually we have actually gone beyond the time that we initially dedicated for the panel. So I guess before we end today's session, I'd just like to pose one last question for all of you, and I think I'll start with Tricia. I'll start with Tricia. So basically, it's this: based on all that we have been discussing just right now and earlier, what is the one major takeaway from this session that you'd like to send across?
Thanks, Emmanuel and Vibes, once again for inviting me.
No
I
worries.
think the one takeaway that I take from this is that we have to balance between short-term and long-term. So I think all three of us have somewhat talked about the need to balance between the long-term and the short-term. Short-term, looking at the vulnerable communities, the informal sector, women, youth, the unemployed, as well as everything that Nazihah has very eloquently said about the public healthcare system. I'm not so much an expert in that, but I completely agree. The medical frontliners and the healthcare system also needs to be considered. But long-term, in terms of long-term restructuring of the economy, and yes, I take it that the documents like 12 Malaysia plan will be more for long-term, but I think also the budget sets the tone for the long-term, and then thinking also about how the revenues are going to be funded. There's construction here in my home, so I'm going to stop and put the mute on. Thank you.
Welcome. How about you, Nazihah?
Yeah, again, thank you for inviting me, and I've had a really, really good discussion learning from the other panelists as well. For me, the one main takeaway is, as for both public health and for social protection, ensuring that people have enough money to pay their bills and put food on their table. So I think now is really not the time for us to worry about our national debt, because it's something that we can afford to delay worrying about later. But what we can't afford to do is delay working on stopping the country losing more lives and stopping the country from stopping people from experiencing more illnesses.
Right, and last but not least, Farhana.
I like what Nazihah said very early on about thinking about costs, right, of the budget, and that's how we started. So that's how we're going to end. Thinking about costs, I think we should really think about the cost of not doing anything, and I really like that as a main takeaway. So I think the budget should worry less about cost and more about the cost of not. And so yeah, our wish list for the budget is for the focus to be continued on well-being of people, because that is in itself a long-term investment.
Okay, all right, and it's a wrap. Thanks everyone for tuning in, and also, I mean, huge thank you to our panelists, Tricia, Farhana, and Nazihah. Now, if you have any feedback over today's session or would like more webinars such as this, do write to us at editor@thevibes.com. That's EDITOR @thevibes.com. Until next time, I'm Emmanuel from The Vibes. See you and stay safe.